Have you ever woken up with a stiff back that makes getting out of bed feel like climbing a mountain? Or twisted your ankle playing football and suddenly every step reminds you how much you took walking for granted? Maybe you're dealing with that constant neck pain from hours hunched over your phone or laptop. If any of that sounds familiar, then listen closely because today we're diving deep into something that can literally change your life: physiotherapy. What exactly is it, and more importantly, why is it absolutely necessary in today's world? Stick around for the next half hour because by the end, you'll wonder why you didn't start sooner. Let's start with the basics. Physiotherapy, also called physical therapy, is a healthcare profession that focuses on helping people restore, maintain, and make the most of their physical strength, movement, and overall well-being. It's not just massage or a few stretches. Trained physiotherapists use a combination of hands-on techniques, targeted exercises, education, and sometimes tools like ultrasound or electrical stimulation to address problems in your muscles, joints, bones, nerves, heart, lungs, and even your balance system. The core idea is simple yet powerful. Your body is designed to move, and when movement goes wrong due to injury, illness, aging, or bad habits, physiotherapy helps bring it back to normal, or even better than before. Think about this. Every single day, millions of people around the world lose mobility. An aging population means more joint wear, more falls, more surgeries. Busy lifestyles mean more desk-related posture problems, more repetitive strain injuries. Sports and accidents add sudden tears and sprains. Without proper intervention, these issues don't just go away. They worsen, leading to chronic pain, dependency on painkillers, reduced independence, and sometimes even the need for surgery that could have been avoided. That's where physiotherapy becomes not just helpful, but necessary. One of the biggest reasons physiotherapy is essential is pain relief without always relying on drugs. Many people pop painkillers daily for back pain, knee pain, or headaches, but those only mask the problem. Physiotherapy goes to the root cause: weak muscles, tight joints, poor posture, scar tissue buildup, and fixes it. Studies and real-world results show that people who do physiotherapy often reduce or eliminate their need for medication, and they experience long-term relief instead of temporary fixes. Imagine living without that nagging ache every morning. That's the power we're talking about. Another huge reason it's necessary: faster and smarter recovery after injury or surgery. If you've ever had an operation, knee replacement, ACL repair, back surgery, or even something simpler like a fracture, your doctor will almost always recommend physiotherapy. Why? Because doing nothing lets scar tissue build up incorrectly, muscles weaken from disuse, and joints stiffen. Physiotherapy prevents that. It guides safe movement, rebuilds strength step by step, improves range of motion, and gets you back to work, sports, or family life much quicker. Patients who follow physiotherapy plans often recover weeks or months faster than those who skip it, and they return to full function with far less risk of re-injury. But here's something most people don't realize. Physiotherapy isn't only for when you're already hurt. It's preventive medicine at its best. Think about it. Regular checkups with a physiotherapist can spot small imbalances or weaknesses before they turn into big problems. Office workers learn proper ergonomics to avoid neck and back issues. Athletes get screened for risky movement patterns that could lead to tears. Older adults build balance and strength to dramatically cut fall risk, which is one of the leading causes of injury in people over 65. In many cases, physiotherapy keeps you out of the hospital altogether. That's necessity, not luxury. Let's talk about chronic conditions, because this is where physiotherapy really shines as something everyone might need eventually. Conditions like arthritis, osteoporosis, diabetes-related nerve issues, heart problems, respiratory diseases, stroke, Parkinson's, multiple sclerosis, the list goes on. Physiotherapy doesn't cure these, but it manages them powerfully. It reduces pain and stiffness in arthritis, improves lung function in breathing disorders, restores movement after stroke, strengthens the heart after cardiac events. For millions living with these lifelong issues, physiotherapy means staying independent longer, walking without a walker, playing with grandkids, or simply enjoying daily life without constant limitation. A common myth that stops people is thinking physiotherapy is just for athletes or young people recovering from sports injuries. That's completely wrong. It helps newborns with developmental delays, kids with cerebral palsy, pregnant women with pelvic pain, new moms recovering after childbirth, middle-aged adults with frozen shoulder or sciatica, and seniors managing age-related decline. Another myth: it's only exercises. No, physiotherapists use manual therapy to release tight tissues, joint mobilizations, dry needling for trigger points, taping for support, education on body mechanics, even breathing techniques. It's a full toolkit tailored exactly to you. People also think you need a referral or a scan before seeing a physiotherapist. In most places today, you can go directly. Physiotherapists are highly trained to assess, diagnose musculoskeletal problems, and decide if imaging or a doctor referral is needed. Many times they catch things early without expensive tests. And cost. Sessions are often comparable to a nice dinner out, but the return on investment is massive. Less pain, fewer doctor visits, avoiding surgery, better quality of life. Perhaps the most eye-opening reason physiotherapy is necessary: it empowers you. A good physiotherapist doesn't just treat you, they teach you. You learn why your pain happens, which movements help or hurt, how to sit, stand, lift, exercise safely at home. That knowledge lasts a lifetime. You're no longer a passive patient waiting for the next pill or appointment. You become in control of your body. In a world where sedentary jobs, screen time, stress, and aging are stacking the odds against our physical health, ignoring physiotherapy is like ignoring regular car maintenance. You might get by for a while, but eventually something breaks down badly. The good news? Starting physiotherapy, whether for an acute problem, chronic issue, or just prevention, is one of the smartest health decisions you can make. So if you're dealing with pain, limited movement, recovering from something, or just want to feel stronger and more capable as you age, don't wait for it to get worse. Find a qualified physiotherapist near you. Ask questions. Start that journey. Your future self will thank you every single day you move without pain. Now that we've covered the basics of what physiotherapy is and why it's non-negotiable for so many, let's go even deeper. Because the more you understand the science and real results behind it, the clearer it becomes. This isn't optional wellness fluff. It's a frontline defense against a world that's making our bodies break down faster than ever. Recent data shows that over 50 million people in places like the US alone seek physical therapy each year, with success rates hovering between 68% and 72% for most conditions. That's not guesswork. That's from ongoing studies confirming measurable improvements with far fewer risks than drugs or surgery. And in 2025 to 2026 trends, demand is skyrocketing due to aging populations, sedentary jobs, post-pandemic recovery needs, and even side effects from weight loss medications causing muscle loss and higher fall risks. Physiotherapy isn't just keeping up, it's becoming essential preventive healthcare. One powerful reason it's necessary: it slashes reliance on opioids and other pain meds dramatically. Chronic pain affects billions globally, and many get trapped in a cycle of pills that only hide symptoms while risking addiction and side effects. Evidence shows physiotherapy can cut opioid needs by huge margins. Some reports highlight up to an 87% reduction in certain pain management scenarios. Why? Because it targets the mechanical causes: poor alignment, muscle imbalances, inflammation from inactivity. Techniques like targeted strengthening, manual release of tight fascia, and progressive loading rebuild resilience so the pain doesn't keep coming back. Patients often report not just less pain, but actually forgetting what constant discomfort feels like after consistent sessions. Let's address more myths head-on, because these stop way too many people from starting. Myth 1: physiotherapy is always painful and you'll leave worse than you came. Reality: while some manual work or initial assessments might feel uncomfortable, like stretching a tight muscle that's been ignored for years, the goal is never to cause harm. Skilled physiotherapists work within your tolerance, using graded exposure so progress feels challenging but safe. Most patients leave sessions feeling looser, stronger, or at least hopeful, not in agony. Another big one: you need scans or a doctor's referral first. In many countries now, including direct access models, you can book straight in. Physiotherapists are experts at red flag screening. If something needs imaging or specialist input, they'll refer you fast. Skipping the wait often means catching issues earlier and avoiding escalation. Myth 3: it's only short-term relief. Problems always return. Not true when done right. Good physiotherapy educates you on root causes and gives lifelong tools, posture cues, home exercises, activity modifications. For low back pain, one of the most common issues, early physiotherapy prevents it from becoming chronic in many cases. Randomized trials show combined approaches, manual therapy plus exercise plus education, deliver lasting functional gains months after treatment ends. Patients who stick with their plans often stay pain-free or manage flares independently instead of rushing back to doctors. Now, let's get real with stories that show the transformation possible. Imagine a construction worker in his 40s who tore his Achilles badly during a run. Doctors pushed surgery with 6 to 9 months recovery. He chose conservative physiotherapy instead, progressive loading, balance work, eccentric strengthening. Within months, he was back on sites, then running again, no knife needed. Or take the office professional with years of neck stiffness turning into daily headaches and limited rotation from disc wear and arthritis. After targeted manual therapy, posture retraining, and home routines, she regained full motion, ditched constant pain meds, and even started enjoying gym sessions pain-free. These aren't rare miracles, they're standard outcomes when plans are personalized. Another inspiring example: someone post-stroke, struggling with one-sided weakness and balance fears. Multidisciplinary rehab including intensive physiotherapy rebuilt gait, strength, and confidence. They went from needing help for basic tasks to walking independently and even returning to hobbies. Or the senior who feared falls after a hip scare, balance training, strength exercises, and education dropped their risk dramatically, letting them stay in their home longer, playing with grandkids without worry. These stories highlight empowerment. Physiotherapy doesn't just fix bodies, it restores independence, joy, and control. Looking ahead to why it's more necessary now than ever, trends in 2026 point to tech integration like AI-guided home programs, wearable sensors for real-time feedback, and value-based care where outcomes matter more than visits. But the core stays human. Your physiotherapist tailors everything to your life, goals, and body. With rising chronic conditions, musculoskeletal disorders exploding from remote work and obesity, preventive physio screens and fixes small issues before they sideline you. It's cost-effective too. One session often equals a dinner out, but prevents thousands in future medical bills, lost work, or surgery. For women specifically, pelvic floor physiotherapy helps hugely with pregnancy pain, postpartum recovery, incontinence, or menopause changes, issues many suffer silently. Kids with developmental delays get targeted play-based therapy to hit milestones. Athletes prevent tears through movement analysis. Everyone benefits because movement is life, and physiotherapy optimizes it at every stage. If you're still on the fence, ask yourself, how much is limited movement costing you right now? In energy, mood, relationships, or missed experiences? Physiotherapy flips that script. Start small. Book an assessment. Be honest about your habits and fears. Commit to the home side. Progress compounds. Small daily wins build into massive change. You've made it this far because something in your body is asking for attention. Honor that. Find a qualified physiotherapist, start the conversation, and reclaim the movement you deserve. Your body has incredible healing potential. Physiotherapy just unlocks it. If this hit home, share with anyone dealing with pain or stiffness, and comment, what's one small step you're ready to take for your body this week? Let's keep the momentum going. Your future, pain-free self is waiting. Go make it happen. Take care.